Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Type IV Hypersensitivity reaction under the section of Immunology. So what is a Type IV hypersensitivity? It is a T-cell mediated delayed hypersensitivity reaction. If you recall, just as a quick recap, we have 4 types of hypersensitivity. Type 1, which is an IgE mediated. Type 2, which is an IgG or IgM antibody mediated. Type 3, which is an immune complex mediated. And then now Type 4, which is the topic of this video, which is a T-cell mediated delayed hypersensitivity reaction. If you would like a refresher of Type 1, 2, or 3 hypersensitivity reactions, please click at the appropriate corner of the video. So with Type IV hypersensitivity reaction, really we are talking about 2 distinct mechanisms, each of them involving T cells. One of them is a direct cell cytotoxicity, which results to CD8 plus cytotoxic T cells killing the target cells. And then the second one is an inflammatory reaction, which is as a result of the effector of CD4 plus T cells recognizing antigens and then release of inflammation inducing cytokines as a result of it. So it's really important to realize that Type IV hypersensitivity reaction does not involve antibodies, which is in complete contrast with Type 1, 2, and Type 3 hypersensitivity reactions. The examples of Type IV hypersensitivity reactions include contact dermatitis. Classic example is a nickel allergy, or drug reaction with eosinophilia and systemic symptoms, or some of you might recognize this syndrome as DRESS syndrome. For instance, it's really quite common with the cases of sulfasalazine or any sulfa drug, and also it's also observed in graft versus host disease. The investigation that you want to do for a suspected case of Type IV hypersensitivity reaction include a MON2 test for previous tuberculosis infection, patch testing for any contact dermatitis, and also candida testing for T-cell immune function. However, as always, the key with these sorts of cases with hypersensitivity reactions rely on having a good and thorough history and carrying out the pertinent examinations. So let's do some questions. Question 1, in Type IV hypersensitivity reactions, the primary cells responsible for the observed tissue damage are A. Helper T cells, B. Cytotoxic T cells, C. Regulatory T cells, D. B cells, E. Natural killer cells. If you recall from our discussions earlier, the correct option in here is going to be cytotoxic T cells. Thanks for listening to this episode of Bite-Sized MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.